All of Ontario will move into what the provincial government is calling shutdown measures. Multiple sources tell CBC News that Ontario Premier Doug Ford will make the announcement at a briefing set to start this afternoon at 1:30 Eastern Time. Laura McQuillan joins us now, just outside the CBC Broadcast Centre. So Laura, let's talk about what Ontario's latest shutdown measures will look like.
Well, John, it's going to be pretty similar to what we saw over the New Year period when Ontario went into a stay-at-home order. It now has a different name, calling it shutdown, but otherwise it is pretty similar to back then. And this is a step further than the lockdown currently in place in some parts of the province, including Toronto, Peel, Sudbury, Thunder Bay and Hamilton. With these new restrictions, it means the entire province will be under the same restrictions, and that includes no more indoor dining, no more gyms or haircuts, even outdoor patios like the one behind me look set to close, though we are waiting to get a bit more clarity on that front from the province. It's telling people they'll have to work from home wherever possible, but at the same time, retail will stay open. So you're told to work from home, but you can go to the mall. There will be capacity limits on that retail, but keeping it open this time around. So a difference there from what we saw back at New Year's. But this is coming as we see just a boom in cases, and in terms of those cases trickling through to intensive care admissions as well. Just seeing this morning from the Ontario Hospitals Association that there are now 430 people in intensive care in Ontario. The peak of the second wave was 420, so already surpassed that. This wave set to continue for a little while, though these measures set to come into place on Saturday for 28 days. And this comes as intensive care doctors urge the province to take action. 153 of them have signed a letter to Premier Doug Ford, the Health Minister, and their top doctor in the province of Ontario. And I want to read you some of what that letter says, saying that the next few days and weeks will be critical. In it they write, "We cannot allow this virus to run free in our population and hope that the expanded ICU capacity in field hospitals are enough. Immediate public health interventions are needed today in order to curb transmission and prevent further unnecessary deaths." They go on to say, "As ICU doctors, we are the last line of defence and we are ringing the alarm bell. Please hear it. We implore you to act now." Now, one of the doctors that signed that is critical care Dr. Jamie Spiegelman. We spoke to him for his take this morning, and here's what he told us.
Lockdown should happen when the hospital system can't handle it, and we're getting to that point, that boiling point where we can't handle it. So I think the next month is very key for hospitals to be able to handle it, especially with Passover, Easter and Ramadan coming up. We're all concerned from families getting together and a lot of people getting together and spreading. At this point, you have to realize what you're doing to your family members and loved ones. I think you have to realize that this is spreading and it's very contagious, and you don't want to put your loved ones at risk.
But a number of doctors, a number of infectious disease specialists say even a shutdown in Ontario won't go far enough, John. They say what the government needs to be doing is targeting more at essential workers, those who still have to go to work every day, whether that's in a manufacturing plant, a food processing facility, getting them sick leave and also getting them vaccinated faster. They say that is something that will make a big difference as we see this third wave continue to rise.
The other element in all of this, schools, of course, what kind of impact we expect it to have on them?
Yeah, parents wondering, what is this going to mean? Is my kid going to be sent home once again? What we do know thus far is next week, after the Easter break, schools are expected to go back. There had been some confusion, one school board saying that schools would shut down, but our colleagues at Radio Canada have confirmed that schools will stay open then. The question mark is what happens after the spring break in April. That's the week of April 12th. Will school go back again after that? Well, yesterday the Education Minister Stephen Lecce seemed to signal that that's what the government is planning to do with some new safety measures for students.
What I can assure families is that our intention is to proceed with the April break, but we're not going to be reintegrating students back into schools without a heightened level of vigilance on that date. So as I've committed to before, we'll bring forth a plan that will highlight and underscore improved safety measures and access to testing that will reduce any potential case entering into our schools.
Of course, parents wanting to see what that plan is going to entail, John, so we'll keep you posted on that front. The Premier, Doug Ford, his Health Minister and some of their top science and medical advisors set to speak on all of this at 1:30 p.m. today.
Thanks for this, Laura.